Welcome to the late third trimester labor and delivery prep plus hip opening and releasing exercises. Starting first with diaphragmatic breathing or hugging the baby. You can start on all fours as seen here or lie on your side in a supported position, but we want to make sure we get that full inhale in, letting your belly drop as you inhale. On the exhale, we are contracting the core, feeling like we're zipping up a zipper from our pelvis all the way up to our chest, hugging the baby with your core. So full inhale, full exhale, just get the core ready. After we do that a few times, we're gonna go into some release work. In postpartum, we actually want the pelvic floor to be strong, but as we get ready for labor and delivery, we want to be able to relax the pelvic floor so it gets out of the way, letting the uterus do the work to push the baby out. In a child's pose position, supported on pillows or pillows, it's good to open up the hips, let everything relax, and do some deep breathing here. Stay here for 10, 20 seconds at a time. You can do this for multiple rounds, but we want to make sure that the hips are supported, open nice and wide, and you're going to breathe, exhaling into the back ribs as you do that breath work. From your supported child's pose position, you can come up to a supported deep squat. So I have my hand on the rail there, so you can use your hands to support, you can sit on the pillow, you can do both, but we want to be in a nice low deep squat to open the hips out to the side, still breathing as you're down there, but depending on your flexibility, elevate it more if you need. So add another pillow, add some blankets, but you can stay here, you can kind of rock side to side, do this again, 10, 20, 30 seconds, whatever feels comfortable. Multiple rounds is also encouraged. From here, if flexibility allows, go ahead and drop one knee down to the ground. You're gonna feel a deeper stretch into your inner hip, so that's where the quad, the front of the leg, comes up and inserts into the hip. I'm gonna rub it right there a little bit so you can see exactly what I'm talking about, but that's where we're opening. That's usually really tight from the weight of the belly, and or if you sit a lot, we need to release that. So 10, 20, 30 seconds. If you want to do an average, just do 20 seconds for everything on each side. And again, when you're in these supported positions, doing a little bit of rocking side to side just kind of gets into areas of the muscles that aren't normally hit, only making it a deeper stretch, a deeper opening. After you do a few of those, we want to offset the hips. So this is going to be a bear plank or tabletop position that we are shifting one knee onto a yoga block or a pillow, and you're going to engage the core and lift the opposite hip up, staying nice and strong in the shoulders. I'm going to do this from the opposite direction after I release from the offset child's pose position, but I want you to see from the front what it looks like to lift the knee up. I'm not rocking over top of that yoga block. I'm just lifting the knee slightly, engaging through the core. This is really good for hip stability. So yes, we are releasing the hips, but we still need them to do their job, nice and stable. So all of it plays into the bigger picture of getting that baby out. So these we're gonna do again, 20 seconds on each side. I would like you to do a offset, so one knee up on that yoga block child's pose before you switch sides. From there, we're gonna start some inversions. So a down dog is a nice, simple inversion that you can do to get your hips above your heart. So we wanna just create room, create space. The reason that we elevate the hips is to loosen up the ligaments in the uterus to, again, be ready to create space to let that baby drop out of our body. So after the inversion, come down back into a tabletop position. We wanna do some stability exercises again for the inner thighs, inner hips. They all play into effect here. So you're gonna do some internal rotation, rotating that leg out to the side, right and then left. Again, good for the inner thighs. Once we release from there, I want you to grab a pillow to sit back on, especially this late in the pregnancy, you want to be supported. We're going into 90-90 hip opener. So you're gonna kind of feel the difference between the inversions. The hips are up, they're elevated, we're releasing, then we're doing a little bit of stability work with those tabletop internal rotations. Now we're going side to side into 90-90 hip openers, wonderful for the hip flexors. They're called 90-90 because you want your hips at a 90-degree angle and your knees at a 90-degree angle as seen here. After you go side to side for 20, 30 seconds or longer, if it feels good, I want you to stay on one side. We're gonna open the side body. So the pregnancy is kind of holding tension in our lats. The side stretch here is going to open that up, and it all plays effect into what is happening beneath it, which is our hips. So open up nice and wide. I want you to do 20-second hold on each side before you come out for one final hip flexor stretch. In a half kneeling position, you're going to do hip flexor rocks all the way out to the side. So the inner knee is facing forward right now. Do that for 20 seconds and then bring it at a slightly closed angle. So we're kind of working at like 45 degrees rocking out to the side. Again, 20 seconds here. You're gonna feel it a little bit differently, and then close it all the way up, going straight forward, 20 seconds, and then you're gonna switch sides, do the same thing before we hit our final inversion. This is shown last because it's not necessarily for everyone, but if you feel comfortable, find an elevated surface. It could be slightly elevated, it could be all the way up on a couch, it could be a bench, anything sturdy, but you're going to elevate your hips. Again, this is higher than that down dog to open up the hips, release the uterine ligaments. This is what helps create space for the baby to push through. You might have heard that this is good for flipping babies. Yes, it is, but if you don't need to flip your baby, it's good to open up and prepare the hips for what is about to happen. And those are all exercises that you can do multiple times a week. You really can't overdo these, so try to do 1 to 2 rounds of 20 to 30 seconds each, maybe 3, 4, 5 days a week, and good luck with happy babies.